STD cases in the U.S. are at an all-time high. That's according to a new CDC report that also says that more than half of all new STD cases occur in young people ages 15 to 24. One factor that was indicated in the study, programs that teach students about STI and STD prevention alongside birth control and safe sex have had significant cuts in recent years. Let's unpack this. There's been a trend toward more abstinence-only programs, which studies show does virtually nothing to stop people from having sex and instead could actually be contributing to the U.S. having the highest rates of teen pregnancy and STDs in the developing world. On the contrary, comprehensive sex ed is an alternative that teaches about birth control, disease prevention, and how to have safe, consensual, healthy sex. Why is that so important? Well, let's take a look at the numbers. 55% of U.S. teens have had sex by the time they're 18, according to data from the Centers for Disease Control and Prevention. But only about half of sexually active teens said they received formal instructions on contraception methods. How is that possible? Well, only 27 states and D.C. actually mandate both sex education and HIV education in schools, according to a Guttmacher Institute report. Only 17 states require those programs be medically accurate. And only 38% of high schools and 14% of middle schools in the U.S. cover all 19 topics identified by the CDC as critical for sex ed, like where to get condoms and how to use them correctly. In the last decade, the CDC reports condom use has been on the decline. Probably no surprise then that adolescents ages 15 to 19 have the highest rates of unintended pregnancies, and as we saw earlier, high levels of STDs. So what's going on? Well, some states are neglecting the importance of sex ed altogether, while most, more specifically 29 states, require that in-school sex education focuses on abstinence. Even though, according to research by the Journal of Adolescent Health, abstinence-only programs fail to succeed at their one goal, delaying teen sex. If kids are not getting information about birth control options, condom use, or STI prevention, and yet are still having sex, what do you think is going to happen? So if states aren't facing the facts, is the national government? Of course not. In recent years, we've seen an even greater shift toward abstinence-only programs on a federal level. Since 1996, more than $2 billion in federal funds have been spent on programs that push no sex before marriage. Those programs got a rebrand around 2015 and are now called sexual risk avoidance programs, which could be dangerous, aligning sex with activities like smoking and illicit drug use, both things that could kill you rather than provide you pleasure, intimacy, and a family. Things shifted slightly during the Obama administration. His team and Congress passed regulations that required sex education programs meet evidence-based requirements in order to get federal dollars. But now things have swung backwards under President Trump. Last year, his administration changed those funding rules to favor groups that promote abstinence. For example, the Christian medical chain Obria, which explicitly prohibits condoms, received nearly $2 million in federal family planning funds for the first time this year. And Planned Parenthood, the largest provider of sex education, lost a lot of funding. Put in those terms, the issue appears partisan, but according to a study by the Sexuality Information and Education Council, more than 90% of both Republicans and Democrats agree sex ed is important. And at least 55% of Republicans believe safe sex education is more effective than abstinence-only programs. Sure, the problem isn't just at a federal level. In recent years, more than half of local programs have experienced budget cuts, resulting in clinic closures, reduced screening, staff loss, and worse care, according to the CDC. But our national government can set the stage for how states will follow, and the programs put in place in each corner of our country. This far into the 21st century, we should be paying attention to the numbers and adjusting our programs accordingly, addressing not just safe sex, but consensual sex, aimed at people from all backgrounds with all gender identities and sexual orientations too. Now, wouldn't that be groundbreaking?